There's a lot of good products out there, but you want to, do you even need it? Are you inflamed? Did you do the testing? You know you have inflammation? If you don't, and you're eating the right foods, you're doing all the other stuff that you're doing, why take an anti-inflammatory? It's one more thing to take. Now, I like anti-inflammatories, and most people need them, or turmeric at least, something.
Right.
But most people do need it. But how much inflammation do you have? Is it cardioreactive inflammation? I know certain things affect that more, and I'm going to go with the ones that are the most scientifically sound, that I know they have the proof that they're working where they need to work. And then you test, take it for a month, retest that lab. Did your inflammation go down? Great, it's working. If it didn't, move on, try something different. Just because it's the coolest new thing doesn't mean it's the thing for you.
Hello, my friends. Welcome back to yet another episode of I Love Being Sober. My name is Tim Westbrook. I'm the CEO of Camelback Recovery here in the always sunny and always sober Scottsdale, Arizona, where my team and I, over the course of many years, have helped thousands of people on their path to recovery. We started this show because there's so much misinformation about addiction treatment, mental illness, and recovery in general. There's just so much more to recovery than just going to inpatient treatment, seeing a therapist, and going to 12-step meetings. All of those things are important, and AA saved my life. However, to find long-term recovery and live happy, joyous, and free, there's a lot more to it than just stopping the drinking, stopping the drugs, stopping the sex addiction, or stopping any addictive behavior for that matter. To live a new life, a person needs new, healthy lifestyle habits. Typically, this includes new eating habits, new exercise habits, new sleeping habits, new hobbies, new interests, new friends. Self-care becomes a priority, and the list goes on. Those are the types of things that we talk about here on this show. Today, I'm here with Dr. Donese Worden, NMD. And Dr. Donese Worden is an award-winning physician, researcher, and global health educator who expertly and compassionately bridges the worlds of conventional and advanced alternative medicine. Highly regarded for her life-changing work, she won the 2014 Hope Award for her significant contribution to prevention and education in behavioral health. This award is given annually by Sierra Tucson, one of the country's premier mental health hospitals and residential treatment facilities. She also won the 2015 Best of Scottsdale Award for naturopathic medical doctor. The title of this interview today is Ancient Healing Traditions for Mental Health and Addiction. And amongst other things, we're going to talk about some of the best ways to support mental health that have been practiced for centuries, and now science is documenting it. Dr. Worden, welcome to the show. I'm so glad to have you here.
Thank you, Tim. I'm looking forward to it.
Absolutely. So, what is an NMD?
It's a naturopathic medical doctor. And in the state of Arizona, I'm licensed like a primary care physician. I can prescribe meds, do minor surgery. But where we kind of cross that bridge is trained in allopathic diagnostics. Allopathic means traditional medicine, right? To diagnose over there with the labs and the imaging, but we're also licensed in clinical nutrition all the way to IV nutrition, in counseling. We really believe in that mind-body connection, in homeopathy, in Chinese medicine and acupuncture, in manipulation similar to chiropractors, and botanical medicine. So we're actually licensed in the pharmaceuticals and the nutraceuticals and botanicals, and we're the only type of doctor that is licensed on both sides of the fence like that.
Okay, so does that mean that you can prescribe like a normal medical doctor?
Yes. Most medications. We've got some restriction, depends on the state, but yes. I only get that prescription pad out as an immediate, what do we need to do right now until we fix the problem? So it's rare to get the prescription pad out, but I do use it.
Okay. And so what gives you the right to claim you are an expert on ancient healing traditions?
Well, maybe one of the reasons I developed and I still teach a course at Arizona State University, Ancient Healing Traditions for Modern Day, and it teaches the principles in an actual, regular 3 credit course in homeopathy, naturopathy, indigenous medicine, in traditional Chinese medicine, in I'm probably forgetting one, but anyway, it's the ancient healing principles. And the reason why I developed it, doctors, nurses, and social workers were working with people, and they'd say, well, I'm doing this, I'm trying this within their different cultures. And the practitioners would say, I have no idea what that is. So I developed the course. I do it on Saturdays. It's for 8 hours for 5 weeks. And we plow through the details. And what's interesting, Tim, is that they're going through just trying to learn for the sake of their patients. By the end of it, because I make them go through different things, they've all changed their lifestyles. And I've had them come back, and many of them, if not most, saying it's changed my life and my family for the better. So it opens their eyes to ancient wisdom is still with us and needs to be looked at.
Right. Okay. So now how does this apply to mental health and addiction?
Well, we need to work on mind, body, and soul with anything that we're working on, especially with addictions and mental health. If you're only working on the physical body, you're only working on chemicals. If you're only working on the mental, emotional side, they're all important. We have to do all of it. But if we forget about that spiritual connection piece, it's always a struggle. And I've known that for years with my patients. And even 20 years ago on the intake, I had, do you have a spiritual belief system or practice? I wasn't asking about religion. I explain it. I don't care if you go to church or not. This is not religion. Do you feel connected to something outside of yourself? Because if they did and they had that, then all the body, mental, emotional stuff is easy to work on when you spend time with the patient. But if they didn't have that connection, I can get a lot of things better, but I can't get them to 100%.
Right. And so what brought you to start, yourself personally? What brought you to this path, or to this, to learning more about becoming a naturopath and this type of healing?
Yeah. So I'd always been interested. I thought I might be a surgeon at one point. That made sense to me. Surgery still does. But then when I found out that there was this type of medicine that bridges both, I said, well, that's for me, because my mother was a naturopath without knowing it. We were eating yogurt before anybody else we didn't have any mental health in our family that we know of. But my son struggled as a started in high school. So that started getting me more and more interested in this. I was still in medical school at the time. So it opened my eyes to the struggles that people can go through with this. And so I learned the system, and what I learned is the system is really broken. I don't have to tell you guys that. It's horrendous. And it really is. And so I knew that the help had to be a different way. And it really was internally working with one person at a time to help them to be able to look at all the things that might be making it more difficult for mental health addiction for that particular person. Not here's a program, everybody just go through it. Now, your program is well respected and done. Camelback Recovery. Those programs work. They do. But we also, at some point, when people are interested of saying, okay, I'm balanced enough, I'm settled enough. Now I really want to dig in deep, into what tests, what kind of labs, what kind of other physical things can we be working on? So, I'd always been interested. In fact, I have a minor in psychology. I almost got my master's degree in it, but I got thrown into a television role, into being an anchor of a TV station. I said, well, I'll get it in broadcasting instead. So day one, I've always been interested in this right here.
Right. Okay, awesome. Okay, now this is the question I have written down. What specific, and I think I already kind of asked you this question, but what specific incident inspired you to become so passionate about this topic?
It was a multitude of incidences. When I started working with patients, I knew right away, no matter how good, I was studying all over Europe, everywhere, bringing back leading edge technologies and techniques and medicines. But I knew if we had an emotional or mental struggle going on, especially with addiction type problems, it was very difficult to get all of those wonderful modalities to work. It was my patients that drove me to understand that you work on my end, you got to work top down. You really have to work on this side of things, whether we have a diagnosed mental disorder or addiction. Even if you don't, everyone has something, a little bit of depression, a little bit of anxiety, a little bit, everyone has something, and we have to address it Once we do, then I have a rapport with the person sitting in front of me, or now it's on Zoom and all these virtual things. I have that rapport, and then we can do great things in medicine.
Right. So what are some of the best ways to support mental health these days?
Wow. Big question. I would say that, the recovery centers are first steps. You've got to go in, you've got to detox, you've got to have the recovery, you've got to have an understanding of the disease or the illness as much as we can. There are, I try to get, I work with, I will say the pharmaceuticals. I don't prescribe them for most cases, I think we can do without them. And I think a lot of the time they do more harm. I'm not a big fan of the chemical way of trying to address this, but there's a time and a place. I think there are interesting tests that people can do, testing for causes of inflammation, working on the gut microbiome, and we can dig into that, Tim, because that's very interesting when we come to addiction. But working on the areas that tend to be forgotten or not even addressed in traditional medicine make a big difference. Food sensitivities. What are you putting in your body? Could be broccoli, but if it causes inflammation, it's no longer healthy. Causes inflammation for your body and your brain. So it's the right kind of labs, cortisol, melatonin, all of these things, looking at your hormones. And then the basic pillars. Are you taking care of the basic pillars? Sleep, your body, physical body, your bowel movements, huge thing that we can talk about. No pun intended. Your energy level, your mental and your spiritual. And if we're taking care of really understanding all of those pillars are really important to us, and we're getting somewhere. I gave a lecture not too long ago at Thelma McMillan, which you probably know. It's a Cedars-Sinai affiliate center, behavioral health center. And I gave a 4-hour workshop to psychiatrists and psychologists in behavioral health and addiction especially. So I've got 4 hours of PowerPoint slides and research and studies on this, but very interesting, the new science and what it's showing us. So to answer the question, it depends. The therapies depend on the individual person. Your therapy, even if we have depression, I don't treat every depression the same. I don't treat every mental health disorder the same. You have to treat the individual. Spend time, know where you need to go, and then do the appropriate testing and make it happen.
Right. Okay. So you mentioned labs, and I just had full diagnostic labs done, and I have them done about every 6 months. And I've realized how important it is to have my labs done and have somebody look at them, because it affects the foods that I eat, the supplements that I take. What's your opinion on having labs done? How often should they be done? And I spend a good amount of money to have them done because it's not covered by insurance.
Yeah. Well, a lot of them are. That's the first place I start, is what labs can be covered under insurance, and after that, then we look at specialty labs. I'm not about putting more stress on the patient with a whole bunch of labs. Once I have a hold of them and we can if they're in contact with me, I know by their symptoms kind of what's going on. You need it at least once a year. That's great. You're doing it every 6 months if you can afford it, because then we can look at prevention. What do we see coming? But changing the diet for the better, that's huge here. Looking at those micronutrient testing is a very important one. Inside the white blood cells, what's getting in or not getting in? Are you deficient in certain proteins? And as we know, phosphatidylserine, choline, for example, we've got to have those for the brain to work properly. And it's very big in addiction. So we look for vitamins, minerals, essential fatty acids inside the white blood cell. That way I say, all right, you're taking all these supplements, which ones do you really need to be on, right? Would be very more specific. And if your gut health is not working well and you're not assimilating and breaking these things down, you're wasting your money with your supplements. And we've got the third problem with supplements is the quality. Probably, in my opinion, 95% or more of what's on the shelf out there is junk, or it has junk in it. So anything that I have with any of the companies that I recommend, I make them give me what's called a certificate of analysis on every single batch, not once a year, once a random. It's a lot of time, a lot of effort, I don't know any other physician. I'm sure there are some out there doing it, but I don't know anybody else going to this extent. I know the health food stores and everybody else isn't doing it, but every bottle, I know it was tested for heavy metals, mercury, bacteria, that it actually has in it what it says on the bottle. Because Tim, if we're wasting your money and at worst putting something in that's causing more harm than good, supplements aren't great. And you shouldn't be, in my opinion, if you're on more than 5 or 6, haven't gotten to the root of the problem. We really shouldn't have to take that many. We need to fix the body, find out where deficiencies are. Why is the deficiency there? Let's fix that instead of here's bags of supplements to take. Now, I use supplements. I do, but I have a real good reason for when I do use them.
So would you prefer supplements taken orally or IV?
Time and a place for all of it. The problem with IV, it's very expensive. It's time consuming, but there are certain nutrients if you are deficient, and especially with addiction, that certain have been stripped out and we need to get to it very fast, or your gut is compromised. You can't rely on your gut to do it, then IV can make sense. But I think sometimes it's used a little overkill whenever we have good quality supplements. If they're encapsulated right, Tim, that means that the capsule itself says, does this particular nutrient need to break open in the stomach, in the small intestine, in the colon, in the jejunum, what part by the pH? Good quality supplements are going to go down and break open where they need to break open. When you go through IV, you're bypassing the gut, but you're putting a little bit more tax on other organs, liver and kidney. So it's always, again, individual. But I don't do as much IVs as I used to. We've gotten where if you fix the gut, you can do most things orally.
So how does a person know if their gut is, how do you say it, operating at 100% or 90% or 50% or not operating? I mean, like, how do you know?
There's all kinds of testing, but here's the biggest test. If your bowel movement should be the size of your forearm that long, it should be about in the middle. There you go. It should be about the size of your wrist in the middle part. It should be a log that's easily passed. You don't have to strain, medium brown color, and it doesn't smell bad. And you don't have tummy aches, and you have that every day. If that's going on, I probably don't need to spend a lot of money testing your gut. But if you do, or you have allergies or skin issues, we may look again at that GI. Basic lab work can tell me something, but usually it takes a little bit more extensive testing. Am I looking for leaky gut? That means things are getting in and you're reacting, or and things are being lost, like your vitamins and minerals and nutrients. So, if you've got osteoporosis or you've got mental issues going on, if you have anything other than that normal bowel, that's the first place I start looking is in the GI, because health begins in the gut, and the enteric nervous system has more neurons in it, not than the brain, but then the whole spinal cord. That enteric nervous system, the brain-gut connection, is one of the biggest exciting areas in medicine. And when the brain's upset, we have addiction, we're worried, whatever it is, mental illness, it affects the gut health, and vice versa. Gut health is bad, you can't produce the serotonin and the dopamine. These brain chemicals are made in the gut and modulated in the gut for the most part. So just working up here and not working in that gut, you're missing a lot of ability to get someone better, a lot better.
So if a person has issues with their gut, like, what do they do?
Go to a doctor that works in gut health. And I'm not talking about a gastroenterologist. Great. If you think you've got problems, go get a colonoscopy, see if you have polyps or other things going on. But even when you have polyps, they say, oh, it's benign. Don't worry, we took them out. Well, why do you have polyps? If you go to integrative medicine docs that we're used to working in gut health, we're testing your microbiome. We're looking for food sensitivities. We're looking for pathogens, that's bacteria, virus, fungal, parasite, any of these things. We're used to working in the area and understand the importance. That's how you find out. But, interesting, the role of that gut microbiome, that's that mixture of bugs we're talking about, good bugs or bad bugs. In substance disorder, it's not we know that the gut microbiome gets changed as a consequence of substance use disorder. It changes that microbiome, but it also may mediate, and by a lot of the studies, the role in mediating the behavioral response of drug abuse. So it's affecting your addiction itself and vice versa. And like I said, all the studies of the bacterial diversity being, hurt with substance abuse, we can work with that. But it's not just go take a probiotic and hope for the best, right? I wish it was that simple, but it might not hurt to try that. But really, our microbiome, those bugs, most of our body is made up of those bugs. People don't realize that. The bacteria, virus, and fungal. Only about 2 to 4% of what our body is, what we consider us, is actually our DNA. The rest of it is a bunch of bugs, organisms. So we've got to learn to play nicely with those organisms and know what they are. And your gut microbiome, now there's a microbiome in all of your body, in your heart, everywhere. But in the gut, that's pretty much set by 3 years old, and you're not going to change it. The only thing that changes that is antibiotics. One antibiotic, your gut microbiome can go back to your normal, your thumbprint, not like anybody else's. Your microbiome's not like anybody else's in the world, just like thumbprint. It can go back in 1 week after one antibiotic. You take 2, take several months, 3 antibiotics, you just messed up your thumbprint. And we have to kind of rebuild from there and try to do our best to get you back to where normal is.
Can you give me an example of what you would do to rebuild someone's gut back to where it originally was?
Well, we can do some testing to find out what bugs are there or are not there and what kind of ratio they are. So we can put in specific probiotics. Now, it's a new field. We don't know a lot. We know lactobacillus, the acidophilus one, has the most studies right now. And right now, it's one of the most beneficial we've got. But there's a time and a place for bifido, for Saccharomyces. So we can look at this and say, all right, you may need a little bit more of this. So you've got to take out what's causing the problem. Is it foods? Is it stress? Is it all these things? We've got to help it. We have different protein powders and things that can help rebuild the gut wall lining and put in the right probiotics, and we can fix the gut. And it is one of the biggest areas I think that's missed. I remember doing a lecture, I think it was Banner Behavioral Health, and it's probably been, 18 years ago. And I had this huge audience of probably 400 or 500 PhDs and psychiatrists and psychologists, and they were all behavioral health experts, right? And I was giving this lecture, and I said, where is serotonin made in the body? And they were saying hypothalamus, pituitary. They had all these answers in the brain. At that time, they didn't know that 98% of serotonin is made in the gut. So it was a big shocker then. And unfortunately, quite a few of them still don't know that. Right. And you have to work on those pieces.
So people that have mental illnesses like depression, anxiety, even bipolar, what are the chances or the likelihood that they have issues with their gut?
I never use 100%, but I will tell you that the majority, and I've never seen one yet that doesn't have a problem with their digestive system. Because remember, if we're stressing mentally and making the stress hormones, that's deteriorating or affecting our gut. And the other way around, what came first, chicken or the egg? Don't know, but they go hand in hand. That brain gut connection is huge in working with any mental health disorder.
Now, I took a test through, I think it's called Thrive Gut Health or Thrive Gut Test. Do you know which one I'm talking about?
I do.
And I took the test and I paid for the premium. And I'll tell you what, I'm looking at these results. I'm like, okay, now what? Right. I've got all of these crazy percentages, and it's like you're deficient here and you're deficient here and you're okay here and you're okay here. But I don't understand. So now what do I do now?
Well, here's the truth. Most 98 or probably more, probably 99% of your doctors aren't going to know either. It's interesting information. You know, your microbiome is off. We can look at certain things and say, okay, this might make sense. But that kind of testing is new. It's very new. It hasn't been completely validated to say, when you find this, this is what you do for that. I think we'll get there one day. It's an interesting, wonderful area. I'm a researcher. I work with, big institutions, designing and conducting clinical research. So I look at these labs and I determine, where do I want the patient's money to go? What kind of information am I going to have that will help me clinically? Or is it just nice and interesting? I think Thrive's doing a great job for what they're doing, but what you're experiencing, so is your doctor. Now what? So I don't,
right.
Those of us experienced in it, we can look at it. We've been trained in it. We can see, maybe get a few ahas that can help you. But most of the ahas that we're going to get, it's like, go back to a really good strain, multi-strain of a probiotic, heal the gut wall lining. It's not really going to change my clinical that much at this point. I think we'll get better information to help us in the future. But right now, I ran them at the beginning, like I read neurotransmitter testing at the beginning. And I said, I can tell by the patient, if you tell me you're depressed, do I need to run an expensive neurotransmitter test to show you what you're deficient in causing the depression? No, I already know that. So I'm very, I love testing. I love labs, don't get me wrong, but I think there is overkill in just running everything with a plethora of information. Look at the patient, talk to you long enough. I'm going to know what the problem is just by talking to you.
Right. Okay. So now I have a bunch of supplements, right?
Yeah.
And then I talk with you, or I go get my labs and I talk with my doctor, and she says, you don't need to take all of these labs, or you don't need to take all of these supplements. But right. I'm like, I paid for them. I'm going to take them because I paid for them, and because I have them, and because it's got to be good to take more rather than less. That's what I think. So tell me about that. What's your?
Let's just play into the addiction personality for a minute, right? More is better. I want it now, and I'm going to do it regardless of whether it's good for me or not, right?
Right.
So I'm just holding you to it for a minute. So without pushing the finger too much, but I will say, usually if somebody's bought it, if you look at it and you say, okay, rotate them and take a little bit once in a while until they're gone, but you really don't need to keep rebuying all this stuff. What's really needed. And remember, your liver and your kidney and your GI need to detox this stuff. Those supplements aren't just, oh, hallelujah, it's all good and it just goes through. No, you're asking your organs to process that, just like a drug. Drugs, in fact, 80% of the drugs are made from botanicals. The botanicals are not benign. They're less side effects than drugs. Supplements aren't benign. You can get to toxicity levels. And if your liver isn't working great, which in substance abuse and these things, we have to look at liver, you're taxing it with a lot of these things. So now you are causing harm. I like asking patients to do a fibroscan. It's an ultrasound. It's called a shear wave ultrasound on your liver. Is it fatty? Is it getting stiff? Fibrosis? Does it look like it's going to cirrhosis? Tells me the percentage of cells. And then guess what? Then we can work on your liver. That's more important than me pumping a bunch of supplements down there, right? And if I see a nutrient deficiency, I'm going to choose something that may use the kidney instead of the liver, instead of taxing the organ that's having a problem.
Gotcha. How is a person going to find good, high quality supplements that and to where they know what they're getting? Okay.
You find someone like me that they can get it, that we've done the homework for you. And I mean a lot of work. But if you don't, it's all okay. But anything you take every day, and this is what I tell everyone, something you take on a consistent basis, if your doctor is not doing it for you or your health food store, which the health food stores certainly aren't, you ask for a certificate of analysis, call the company, say, send me the testing on this particular batch. Because sometimes if they send you something, it might be a year ago, and now they have all new raw material from China coming in and you have no idea what you're getting. Good companies are going to do that analysis and they're happy to share. But if you don't mind doing that work, fine. But it's up to you for the quality if you're not going to go through, a process where it's already been done for you. Ask for the analysis. It's important. Because like I said at the beginning, I'll say 95 to 98% have things in there that shouldn't be in there. And that's documented. It's the industry's corrupt. And it doesn't matter if it has a doctor's name on it. They may think it's great. They like the formula, the way it looked, work with the formulator. But if they haven't worked in the industry like I have, they don't know, the importance of making sure that all the raw materials are tested and the end. So in other words, raw materials, they put it in the capsule. By the time they manufacture it, did it get water in there? You have to look at the end batch run as well. That's the extent I go to, because first do no harm. I'd rather you take nothing than a poor quality, something that could actually cause more damage than good.
I've never heard of asking for an analysis on my supplements. I've never heard of that before.
Right. I'm the only one.
And I don't even know how would I do that? Would I just look at the label and call them?
Yep.
And will they give the average person an analysis?
Yes, if they are doing the testing, which by the way, if they say it's expensive, it's not. If they are doing that testing, they'd be glad to give it to you. If they won't, you've got a big red flag. They're probably not doing the testing, and you shouldn't be taking that supplement. They hate, the industry kind of hates me doing this, but it needs to be done. That's how we clean things up. So that's why we hold industry leaders to the standards that they should be doing. We have to start doing it. We have to do it because no one regulates it. The FDA supplements are regulated as a food, which means until there's a bunch of complaints or deaths or problems, we're not going to really see it. And then they get dinged, they get a letter, they have time to clean it up, and they do for a while until they don't again. So there are a lot of bad players in this industry. I formulated some of the top, in fact, at the time, the top helped formulate some of the top nutraceuticals in the industry that were at Sprouts and Whole Foods. I know what goes on here. And your doctors that have their private labels, they may really have the best intention at heart. And I know they do. And they're looking for quality control, what the reps are telling them. But boy, it takes a lot to, even with good quality companies, I still make them give me that. I want to know that they didn't get a batch in from China that has arsenic in it, and they used it anyway because it would cost too much to replace it.
What's your opinion on buying supplements from Costco or Sprouts or just off the shelf?
If you, again, up to you, go buy what you think you might need. Again, you're guessing. You're spending money not knowing what you're doing with it. But if you are just wanting to take a basic multi, these things, you can go buy it, but it's up to you to do the analysis. What I will say is what I've done, and I don't want to self-promote here, but I do want people to have access. On my website, every company and every product that's on there, I've got all the analysis, and milligram per milligram, it's no more expensive than what you're going to spend at Costco and Sprouts. It doesn't cost more. So this bottle of CoQ10 and this bottle of CoQ10, one may be $30, one $15, and you go, well, that one's more expensive. Well, this is a 2-month supply, and it's got twice the amount of milligrams. You have to look at it that way. You can't just go for the cheapest or the most expensive either. Sometimes it's a marketing gimmick to say, hey, mine's more expensive, it's better. Not necessarily. So look at milligram per milligram, look at the dosage. How many dosages are you getting? 30 to 30. You're not going to pay more for good quality is what I'm trying to say here. You shouldn't be paying more for the highest quality that's been tested.
Wow. Okay. And by the way, we're going to, at the end of the episode, we are going to let people know how they can find you and your website and all of that information. Okay. So now switching gears a little bit, what is the benefit of sweating it out in a sauna?
Well, a lot of benefits. If you think about, the skin is the largest detox organ in the body. It's the largest, it's an organ. And it's the largest one. And when we sweat, we are literally detoxing out things that shouldn't be in the body. The body's pretty smart of trying to get rid of chemicals and other things. So sweating is always a good thing. But what I will, and infrared saunas are better than going outside in the sun and getting a lot of, and heating from the outside. There's a whole different mechanism. You create heat in the area around you. That's hot, makes you sweat, is very different than like a sauna, infrared sauna. Compared to regular sauna, is only 20% of the air is being heated. It's asking your body to do it. Different mechanism, works better. I will say, I think we need to be really careful when you're sweating, because if you're on a medication that is very tightly regulated, lithium, something like that, and you're only doing a once a day dosage, if you take that dosage and then you go sweat immediately after, you just may have been sweating out some of your dosage. You need to make your sweat farther away from the medication. And I think that's not, we don't talk about that enough either. If you've decided to take a medicine for whatever reason, and it needs to be in for a certain amount of time, even an antibiotic, whatever it is, sweating needs to be separated.
And so you mentioned a regular sauna versus an infrared sauna.
Yeah.
And it's obvious that you prefer an infrared sauna.
Yeah.
Are there still benefits? Is a regular sauna similar to just going outside and sweating because you're not heating from the inside?
It is. It's kind of creating the heat in the air around you. That's what it's doing. Now, I love steam saunas. I just love them. They just feel good to me. But when you look at the health benefits of, well, how much does it get out? How much does it tax the system? If you look at it closely, infrared has clear benefits outside of, regular sweating. And there are a lot of studies have been done on it, for weight loss to, a lot of clinical testing. I mean, it's amazing. Anti-inflammatory, it's been shown to get out certain chemicals and toxins. There are many, many benefits, and people can just look it up, to be able to see how many studies and how many health benefits are there. But from your community, that detox standpoint and that benefit to skin and to brain, and being able to look at what can it help, it's just great. Chronic fatigue, it helps you with exercise. Cardiovascular, helps your heart, helps with depression. There's actually studies on infrared sauna with depression and fibromyalgia and other things. So I like it for a lot of reasons.
How often should someone sit in an infrared sauna?
So it depends on
how often and for how long?
Right. It depends on what you're trying to do. Clinical trials show us that if you're trying to lose weight, you want to be at about 130 degrees. That's too cold for me. I like it hotter, but 130 degrees 3 times a week. And in 8 weeks, you'll lose like 20% of, body, actually 4% of your weight, but you're losing a lot more body fat. If you can go faster than that, 5 days a week. But if we're looking at it for detox, you have to look at, are your adrenal glands already tired? Are you tired? If you get up or sit up quickly and you've got a lightheaded, if you haven't been tested for your cortisol, if you can't adjust that blood pressure, getting up, standing up, your adrenal glands are tired. You shouldn't be pushing into hot yoga and into infrared too hot for too long. So it depends, right? But if you're in good health, organs are working well, you just want to keep things going, then, I don't have a problem with 3 to 5 days a week. But how long? It's really about how long you want to sweat. If you can break a good sweat for 10 to 20 minutes, that's kind of what we're after. Whatever temperature or length to get there is kind of, you have to judge it.
Is 45 minutes excessive?
No.
Is an hour excessive?
No, if it's at a lower temperature and if your adrenal glands are fine, and if you don't have what we call this orthostatic hypotension, if your adrenal glands are working well, they're not taxed, if your hormones are balanced, if you're in tip-top shape, it's absolutely fine.
Okay.
And it helps you sleep. It helps a lot of things.
Right. No, I love it. I go to, there's a place I go to, by me called Optimize, and they have infrared sauna. They have red light therapy. So let's talk about red light therapy. What's your opinion on red light? And I know it's just the infrared is a different nanometer, right? And it's invisible, whereas red light you can actually see. So talk to me about red light therapy.
So my mentor in energy medicine, Dr. Bill Tiller, he was chair of the physics department at Stanford for 40 years. I've worked with him for 20 years, lectured on laser physics and all that. This is an area I know well. I've lectured to doctors and taught this Red light is fantastic, 635 nanometers. It helps wounds and burns. I use in my clinic. I use cold lasers to do all these things. It's fantastic. Most of the better infrared saunas now have red light or different colored lights. as part of it, just because they're giving you more of a full spectrum of it. The ones that I give to, I became a distributor to get better pricing for my patients is the way to say this, but the company that I use really is a full spectrum. It's near, far, and mid infrared. We won't get into the details of why I chose that. There's a little bit of push from different communities, but at this point, that's what I think is best. And they've got all the different colors, but red light is fantastic. The Russians have been studying it for 60 years. I mean, we know a lot, and we have a lot of science about red light, those cold frequencies, and they're amazing.
Right. What are some of the benefits off the top of your head of red light therapy?
ATP gives energy inside the cells for the cell to do repair. That's number one. If you're repairing the cell and you're getting the mitochondria to make more energy, your ATP, that helps everything, right? It's beyond wounds and pain and skin, neurological. I mean, I got introduced to it. My mother, very healthy, went in for a simple medical procedure. It was a medical mistake. They messed up and they stroked her. And this was maybe 30 years ago. And I immediately knew what was just kind of like in the recovery, community. I won't say recovery community, but in the mental health community, I knew nothing. There wasn't at that point, there's still not much offered for neurological help and rehab for stroke. It's like, well, learn to live with it. You're not going to talk. You're not going to walk. You're not going to have any quality of life. Probably can't swallow all this. I got introduced to cold lasers at that point, and I saw what it did and gave my mom that quality of life. She did all the things she was not supposed to live, but much less be able to have a quality of life. And I've worked with stroke patients, neurological, the frequency. That's a whole lecture and a whole podcast we could do, which is fascinating about the electrical magnetic body and the science behind that, but it's real. And when we're talking about mental health isn't just in the physical with the microbiome, with all these, neurotransmitters, all this testing, these things we're talking about. Hormones are huge, need to be tested, but what about the electrical part of the body? And when you balance that, when you work with that affects the autonomic nervous system, which affects the brain and the gut, all of it. So the body is electrical. We're beyond debating that. So working with that's important, and I love it. You can tell it's one of my passions.
I'm all about, I've got a red light right there next to me, and right. I sit in front of my red light for 10 to 20 minutes, typically in the morning, and yep. I love it. It just helps me get my day started. And sure. It's like, do I feel better as a result of the red light therapy? I don't know. I think so. I feel pretty good.
Well, here's the time to talk about placebo. Placebo is real. Now, I will tell you, I know that red light, according if it's at 635 nanometers, I haven't looked at yours, but if it's a really good one doing the right thing, it's going to help a lot of things in you. But even if it wasn't, let's say it was a fake red light with nothing going on, there's no such thing. Right. But if it was, you believing that that's going to help you, you release a cascade of neurochemicals or brain chemicals, your hormones. You release all this stuff saying, hey, I am being healed. I'm in good shape. Look at this. I love this. I'm going to be better. And that your body's own pharmacy that you just activated is far stronger than any medicine, any light, any technology, any IV, any supplement will ever be. So placebo is real, and whatever makes you feel good is real, regardless of if I had a double-blind because placebo-controlled study, which we do with red light. But anyway.
Well, it's just like my Aura Ring. I told you my Aura Ring said that I had 2 hours and 31 minutes of deep sleep last night and almost 2 hours of REM sleep. I'm like, I feel great. So even if I don't feel great, I feel great. Because my Aura Ring says that I feel great.
Your Aura Ring says go to it. Now's the day to go and do more exercise. I think that's one of the most beneficial things it says, or it says, hey, you didn't sleep very well. You need to take it easy today. Now, should we be able to tap into ourselves and feel that and know that? Absolutely. Right. But we like technology. We like reminders. I like it because if you're passionate with your purpose and you've got drive, your mental can fool you. Your mental can say, get up, go, this is great, let's go, go, go. And your body's going, I am so tired but your mental will override it. And you see that with addiction, right? As well. The mental can override it. And that's where the Aura Ring or those kind of wearables come in, that you actually look at it and go, okay, even though I feel okay and I'm ready to go do 100 things today, I know that I might want to take it a little easier, because we haven't learned, if you haven't been able to get into your meditation or some kind of practice where you can learn, today is a day where I'm set, I'm good, I'm all my mind, body, spirit, soul, everything is set. Today's a really good day to create or to go do more exercise. If you're not there yet, these wearables are great. And why not?
Yeah, why not both? Why not all of it? I mean, I do all of it. Yeah. So what's your opinion on cold water therapy?
I think it has really benefit. You know, the athletes like to use it, the vasoconstriction. There are long-term health benefits. I will say in naturopathy, day one of our medical school, we were taught it's really contrast hydrotherapy. Hydrotherapy has been used for centuries for all kinds of disorders, mental, physical, all that, but it's contrasting hot, cold, hot, cold. We still use it with certain kinds of injuries. You always want to end in cold. So I really like contrast hot, cold when we're really trying to shove something into a different direction. But plunging into that cold does affect the immune system in a good way. It does a lot of the same things that infrared does, right? They both work, and they stimulate fat cells and all the things that we like to use with infrared. You can do with cold. I will just say it doesn't have as much science or studies behind it yet as hot therapies do.
Okay.
But I like it.
So with the cold plunge, let's say I go and I do an ice bath, and then I hop in the infrared sauna, and I can sit there for 25 minutes without even, and still feel pretty comfortable. Am I still getting the benefits of the infrared sauna because I'm not sweating, but I'm still getting the infrared light?
Yeah, I mean, part of it. You know, we don't have the science to pull that out for me to give you an accurate, this percentage of cells, this and that. But yes, just the infrared, like the red light, there's benefit to just that hitting your skin and hitting you, asking the body to activate some things. But if you're not creating the sweat, you're not getting the full benefit, would be the way to say it. Okay. You're not getting the full benefit. So, but you're getting a different kind of benefit because you went from cold to hot. But if you're doing true contrast hydrotherapy, you would end in cold again.
I always end in cold. I always end in cold.
Excellent.
Especially in the summer when it's cold outside. I don't like ending on the cold because I'm cold for hours.
Right.
Literally. Right. I mean, I did an ice bath this morning and I feel great. I mean, it's like I'm awake. Right. I'm mentally alert. I've decreased inflammation. Like, it's great. Right. I feel great.
That's right. You know, cryotherapy was interesting. I had a group come to me, again, because I've been working with lasers and these things for a long time, probably about, I don't know, it's probably been about 8 years ago, a big, huge cryotherapy. They wanted to put franchises together, wanted me to be part of it. I started deep diving into the science, and even to date, we have inadequate scientific evidence. It's inadequate, but generally there are things that we do believe that it does help with. There's more science behind it now. I think, as with anything, we've got to be really careful. More is not better, and the most is not better. I mean, I'm a big fan of hyperbaric oxygen therapy. One of the things that I learned about, again, many years ago because of my mother with the mental, but now we use it in the cancer treatments that with the metabolic world. I do metabolic cancer treatments, proponent, and work with the top researchers in that. That's a whole nother discussion. We've gone down the wrong path. In our opinion, cancer is not a genetic disease. Only probably 3 to 4% are genetic. The rest of them are metabolic disease, and hyperbaric oxygen, keto, other modalities that we have work. And we have people alive that shouldn't be alive today because of these therapies, and doing really well, even with brain tumors.
Wow.
So lots of exciting things happening on the research world that I'm involved in. That's not part of what we're talking about today. But what I will say is the same therapies that were being studied for, and this is important to our group. Dominic D'Agostino is somebody at University of Southern Florida you guys can look into. He'd be a great person to have on your podcast. If you can get him time-wise, I'd spent a couple hours with him yesterday. We worked together on research and things, but he is funded by the Department of Defense, for NASA, the Navy SEALs, for the rebreathers. They got to take these guys down at big, low levels of oxygen. They would get seizures because of the pressure. And he started studying, how can we make them stronger, faster, better, our warriors. That was his funding. Let's find out how to make them better, to be able to withstand extreme stresses to the body, mind, all of it. And how do we get them better? Well, his research was showing hyperbaric oxygen, ketogenic diet, all kinds of things, the esters. I won't get into all of it, but what he found at the time was, wow, guess what? It was killing cancer cells. He could see it under the microscope. That led him to Dr. Seyfried in Boston. And now we've got our group of lots of studies, lots of this going on. But here's the news. If we want to help our brain, if we want to help from the neurotoxicities, all that, these same therapies that work on cancer and make the warriors faster and stronger and better are the same thing that I use on any of my patients appropriately, to be able to say, these are the things you might consider. Because even if you're healthy and everything's going great, like is there another step? Is there one more step to get you there? Because it's about longevity as well, feeling great, being healthy, and preventing as much as we can. So it's exciting, but it's not, we're back to ancient wisdom, right? These basics are critical. And then we've got leading edge, more information about it. But diet, lifestyle, hyperbaric, heat, these things that are in their own way used for centuries are now some of the best therapies we have.
Explain what a hyperbaric chamber is.
Yes. So most people will know it because if you're diving and you get the binge, you went too low, the oxygen was off, you have to use hyperbaric to get you back. So right now what it does, it's an exchange. There's a long process but the way we use it, it's wound healing, it's neurological. It's getting your body to exchange the CO2, oxygen. It's way beyond that, but it's getting stimulating your own body to produce a response to this pressurized, like we do 100% oxygen at 2.4 atmospheres. That means we're taking you down like as if you were diving. That stresses the body in a good way. Your body mounts a response, and that response starts to heal a lot of things.
And how often should someone go into a hyperbaric chamber?
You're going to know.
Right? I've done it several times. I don't know if I really felt the benefits of it.
You would. Most people don't. That cancer patients, you're not going to feel immediate benefit. This is working at a deeper level. This is activating deep cellular things as well as organs and all. It's activating the body to start repairing and doing. It's not like an immediate, oh, I feel better. I will say this, people who have some kind of infection, even current infections, they feel better and they can breathe better if they go into hyperbaric oxygen. They can feel immediate relief, but you got to be careful. If you have a lung issue, you shouldn't be going, a severe lung issue, you shouldn't go into hyperbaric. So again, it's individualized, who should be in there for how long, at what dosage, atmosphere, all that. But it is very beneficial. And if you just want to do it for the goodness of your body, go in every once in a while, but you would be better off going through a series of them, like maybe twice a week for a few weeks and just one every 6 months. It's not going to keep the activation going. Do a series, short series is better than just once in a blue moon.
Okay. So going back to cold water therapy and cryotherapy, tell me the difference between, or the benefits between the two, because I've done both. I like the cold plunge way more than cryotherapy, and I've done both lots of times. Right.
There again, from a scientific standpoint, research, I can't tell you. I will say that the immersion therapies, the cold immersion, there are studies on that. With inflammation, I think they probably all work a little bit on the same things. They may be working in the same pathways, but you're just going about it differently. We don't know enough science right now for me to answer that question. I would say you answered the question for me. Which one do you feel better with? That's the one you do.
Right. Okay.
And it's less expensive.
Right. Yeah. Okay. What is your opinion of NAD plus?
Oh, wow. Okay. So now you're going down the pathway. The science is really interesting, really great for anti-aging, for a lot of things. David Simon's work, all this. I mean, there's a lot of very, very interesting work. But in my side of things, on my group of researchers, when we look at it, we're not so sure. We don't know yet that it couldn't also feed or increase cancer growth. Even David Simon in his book had kind of said, we don't know enough yet. So for everybody going out there doing a bunch of NAD, I've got a problem with it for now. Could be wrong. It may end up being fine. But until we know, I'm not putting everybody on a bunch of NAD. You feel better, but you do with cocaine too. Right? I'm just saying it's not about an immediate, oh, I feel better. This is great. You've got to say, why are you feeling better? What is it doing in the body? And it could be the most amazing, wonderful new thing. Right now, it's the hot topic. All the anti-aging docs, all the integrative, functional medicine doc, everybody's on it, doing NAD IVs. Everybody's doing it. Everybody feels good after they do it. Okay, that's great. But I don't know enough now. And by my researchers who do, real hard science biochemists and all, we've got some mouse studies that we're a little concerned, is what I'll say at this point.
Okay. So people that are in recovery from mental illness and addiction, I've heard that NAD plus is a good way to go, but you're saying that we don't know.
I don't know long term on it. That's the problem. I mean, if you're doing a little bit of it for a short period of time during recovery and it seems to be working and you guys are seeing it on your clinical side of recovery, what you're working with, go for it. But to put somebody on high doses or even oral doses for long periods of time, that's where I have concern.
What's your opinion? Do you have an opinion on taking it subcutaneously versus IV?
Again, if we look at the pathways that those of us that work with injections and have worked with it and all, we can postulate that a certain type of molecule might work better this way than that way. But everybody's still in I don't know. It's still in the hypothesis, maybe thing. It's still in debate format. We don't know yet. There's no real data to know for sure which way is better. And everybody's got an opinion, those doctors that are working in these kinds of fields.
Right. Ozone therapy.
Yeah. It's along the same line of hyperbaric. For now, we've got more studies on hyperbaric oxygen than we do on ozone. I love ozone for a lot of things. You've got an infection, all those kinds of things, but using it as only an oxidative therapy, that means you've got antioxidant and oxidative. And the body is about balance. It's supposed to go through both. So too much of one inhibits the other. So it's always about balance. So doing ozone therapy, I think it has a lot of stimulation of helping the body repair those things. We have some studies on ozone, enough to say we think it's safe, right? But there's not as much as hyperbaric. So I'm more of a fan of hyperbaric for all the things that, most of the things that ozone does, but there's a time and a place. You got a bacterial infection in the blood. I like the idea of an ozone IV going through there, right? To help with the infection, if we know it's there. But it's all about dosage and timing. And that's what we found out through all of our cancer, is that it's called press pulse. So with our cancer patients, certain things they stay on, they don't come off, they don't get out of ketosis. We keep them in ketosis. Nutritional ketosis if we can, but we may have to add in other things to help them stay there. But there's other things that we pulse. That means you do hyperbaric for maybe 2 weeks, and then you hold off for 2 weeks, and then you do it again. Again, it's going to be the same thing with ozone when that starts being studied in our community, but right now it's not. We're on hyperbaric. We know that pulsing things, certain things, is the way to go. And just always doing the same thing full out all the time is the body's a lot of reasons, but the body starts to ignore it, and you kind of wake it up. You hit it with something, it goes, oh, what's that? I need to do something. And then it goes away and you let it kind of forget about it, and then you put it in. So there's certain things that we pulse, and there's certain things that are pressed that we keep pressing in our cancer therapies. And it's the same thing for anything, whether you have cancer or not, any disease, just trying to get better. more all the time is not better. And I like you rotating supplements sometimes and rotating brands. Wake the body up. Let's shake it up. Let it, and probiotics, that is the one area that I will say the beginning science right now is saying, and I used to say, rotate your probiotics so you get different strains, different bugs from different things because you don't know what you're doing with it. But if you've got a really good scientifically probiotic that actually has studies behind it, the studies are showing us you don't have to rotate those brands. You could stick on one good one. But everything else, until we know, I like rotation. I like rotating your diet, different foods, different minerals, different toxins in the foods. Rotate. Right. Don't get stuck in a rut. And as you know, with mental health, a lot of times we get tunnel vision. Got this, stick here.
I got my routine. I got my thing. This is what I like to do. And
you should. I'm not saying don't get out of the routine. That's the press part. Right. Remember, that's the side of you need to press certain things. But what you could do is rotate your supplements. What you could do is rotate a few foods in there. So variety is important for us.
Right.
But routine, as far as addiction of what's working, you don't mess with that. You find something that works, you do stick with that.
So explain, would you mind explaining what ozone therapy is to our listeners?
Well, ozone is, again, we're just kind of working with oxygen. We're working with what we call oxidative therapies. It's about oxygen and how that plays with us, with our bodies. So ozone is a gas, and it activates our own body to produce its own chemicals to do that. It's the easiest way I can explain it. But ozone is a gas. You can do ozone rectal insufflation. You can go IV. You can do it in a bag to certain areas. And it's using oxygen, so to speak. It's farther than that, but it's using those oxygen type molecules to help heal the body and to kill pathogens, bacteria, viruses, fungals.
Now, I've done the IV bag, but I've also done just IV directly into my vein.
Yeah.
And I think it's it feels like I get a bigger punch when it's direct to my vein, right?
I think you do. And that's what I say when I think we need ozone for an infection in the bloodstream and overall bloodstream, and it usually goes through a UV light at the same time as well. So it's killing those what it does is pull the blood out of the body, and it ozonates it. Puts oxygen on it, and it does a UV light, and it kills as much as it can, and it puts it back in. So it's your own blood coming back in, but it's sterilized, so to speak. And it's hoping to give you an overall, now you have less of the bad things in your body so your immune system can take care of it. It's never going to eradicate all of it. But yeah, go ahead.
I was just going to say, when I had COVID back in December, I went in, I had ozone therapy, and I had NAD. And that was what I did. And I don't know.
A lot of people with COVID are using hyperbaric oxygen. We've got other molecules that we use. So if you're working with a doctor that knows how to help the immune system, that's great. But I want to say one thing here. What is it about COVID that kills people? What is the process that COVID does? The virus isn't killing you. It makes your body go into a cytokine storm. That means your immune system is overactive. It's supposed to go in and try to take care of, but if it keeps being more and more active, you go into a cytokine storm, and that's what kills you. So this whole thing, let's increase our immune system. Let's do all this with all these supplements, all this stuff. It's like, whoa, wait a minute here. The problem is, we don't have an immune system that's adaptable. By the way, we have a way of testing that to see how adaptable your immune system is. Because if it's adaptable and it can mount a response, kill what it needs to kill or help, and then calm back down again, yay, we're good. But if it's not adaptable, again, is that when you just say, let's do everything known to man to increase your immune system? Not necessarily. Not necessarily, because if I'm doing that and you get COVID, then am I throwing you into a cytokine storm? And that's something that needs to be known. More, again, is not better.
Right. So inflammation. So inflammation, I know is like we have inflammation in the brain, inflammation in our muscles, inflammation in our body, and inflammation causes lots of negative things, right?
All the chronic degenerative diseases, cancer, Alzheimer's, Parkinson's, arthritis, diabetes, you name it, they're all based in inflammation. You're correct. All of them. Chronic degenerative are based in inflammation. There's other triggers, but inflammation is the root cause of a lot of problems, and brain inflammation, which affects addiction.
Right. And so really anything that causes inflammation is not a good thing. Right. Now, so there's a supplement that I take. It's called Sericor NK. Have you heard of that before?
I have.
Do you like that as a supplement for inflammation?
Again, it depends on what type of inflammation. Where's it going? Have I identified your C-reactor protein? I know you've got inflammation going. If you do, and I need to get it down, then we're going to look at the least expensive, best quality way to go. There's a lot of good products out there, but do you even need it? Are you inflamed? Did you do the testing? You know you have inflammation? If you don't, and you're eating the right foods, you're doing all the other stuff that you're doing, why take an anti-inflammatory? It's one more thing to take. Now, I like anti-inflammatories, and most people need them, or turmeric at least, something.
Right.
But most people do need it. But how much inflammation do you have? Is it cardio-reactive inflammation? I know certain things affect that more, and I'm going to go with the ones that are the most scientifically sound, that I know they have the proof that they're working where they need to work. And then you test. Take it for a month, retest that lab. Did your inflammation go down? Great, it's working. If it didn't, move on. Try something different. Just because it's the coolest new thing doesn't mean it's the thing for you. Always.
Right. So if is there a question that you have always wanted to be asked, but the interviewer never got around to it? If so, what is that question?
You know what? You asked me about that to begin with, and I thought maybe that was just if I had something I was going to tell you about it. I think I've been asked so many questions that, let me think here, for your listeners today. I think we've got to think about how well all this virtual mental health is really working. It's the best that we can do sometimes. I mean, I work with people from all over the world. I have for years, because they can't get to me, but it's always best in person. It's always best to have that human connection, because there is an energy exchange, frequency, literally, that we can measure between me and you when we're close together. Now, there is science showing that we're having it even right now remotely, and it sounds woo, but it's not. Scientifically, it's been proven you can change the pH of water across the world with a group of meditators. That's Dr. Bill Tiller, my mentor. And trust me, he could run science around anybody. He's hard scientist. So there is energy exchange. We need to remember that it's not just about the physical body. It's not just about the mental or even the emotional. This different exchange between the energies of us is very, very important. And that would be going back to the ancient healing traditions of community. You have your tribe. When someone a baby was born, they created a song. That was their identity. Every birthday, that song, the community knew it. It identified. We had true identities. We knew who we were. We have a tribe, and that we're not only connected to the tribe, but we're also connected to the planet. The electromagnetic field of the planet. That's all the bioenergetic things that we won't get into. But we're connected to the cosmos as well. Transylvania effect is when there's a full moon, we sleep less. We don't sleep as long, and it's harder to get to sleep. We are connected to the cosmos, to the planet, to our tribe, and to ourselves. And that's ancient healing, dancing, drumming, music. We've forgotten the power of all of these things. And I think one of the best, least expensive ways to shift your mood and to help your body heal is music and creating a playlist. I'll give a shout out to my husband, Barry Goldstein. He works with Dr. Joe Dispenza, Dr. Daniel Amen. I can keep naming all the names. Bulletproof, Dave Asprey, doing some things with him, frequencies. But that's how we met, he and I, about these frequencies. I was using it medically, and he was using it in music. Right. But music can shift your mood and that attitude in you quickly. Nothing quicker than putting on a music and create your playlist around the emotion. Do you want to feel happier? Do you want to feel more relaxed? It's an emotional, he calls it being the DJ of your life. His book, The Secret Language of the Heart, takes you through the steps. But start using music to create the mood and the emotion you want to be in, because when you're there, that body's own pharmacy, That's far smarter and better than anything we've got. Morphine's the strongest pain medicine we have. 10 to the ninth power stronger than morphine is what your body makes itself. We will never come up with something that's far stronger than us. Let's start using music and community and dance and tribe and have fun. That's ancient healing. That's what they had and that we need to bring back.
Absolutely. And I mean, I'm just, as you're talking, I'm thinking about, like, I go work out at F45 and the music is loud and super fun and the community is fun. And if the music's not that good one day, it's like, that wasn't as good of a workout. I mean, when I go over to Optimize, it's Tibetan chanting music and it's calm and serene. And then when I saw your husband speak, and he said when you go to sleep, find music that plays at 60 beats per minute.
Yeah. So we know that when we slow down the heart rate to 60 beats per minute, the brain waves follow. So now we're not in this crazy beta. We're allowing it to go down, because sometimes your brain can still be up here and you fall asleep because you're exhausted, but you're not sleeping well because the brain waves are still up here. Music helps you transition down. So his music at 60 beats per minute, the composition has to have not a lot of melody, no birds and whistles and all that your brain goes, oh, I like that part, or I heard that. No, it's ambient. It's like a soft bed around you, and your brain and your heart waves start becoming more coherent. They match. The patterns are very coherent. They slow down. Now you get the restorative sleep, and you can do it during your day. If you're having a bad day and something made you angry, hey, put on maybe you need your happy song that gets you upbeat, or maybe you need the songs that calm you down. So I want to ask you, what's your happy song? If you had to name one song that you put it on and you can't help, no matter what's going on in your life, you can't help but go, oh my gosh, that is my happy song. I feel happy.
Right now I'm listening to a song by Darkness called, I forgot the name of it, but I've been listening to that song. Like, I've listened to it. It's an old song. Yeah. That's what I've been listening to recently. Yeah. And it just gets me going. I believe, I believe in a thing called love. Love is only a feeling by the Darkness.
Nice.
And that's what I've been listening to recently.
That one resonates with you, right? And when we're talking about mental health, everybody should have a happy song. Those classes at ASU that I teach, right? I've had hundreds and hundreds, probably 1,000 by now, people in those classes. And we work with the happy song thing. I had one person that could not come up with, through the whole course, 8 weeks, couldn't come up with any song that made him happy. Now you can imagine what he was dealing with. By the end, we found one for him. We said, you're just going to listen to this because it made him happy. But I think music is profound, and it's been used for centuries, and we need to do more of it. Mine is a fun one. Mine is, how old I am is Kung Fu Fighting by Carl Davis. You got to be old to know that song. If you don't know it, you put on Everybody Was Kung Fu Fighting. I don't care what's going on in my day. Everything that's falling apart or is going wrong, I put that on. I do my Kung Fu Fighting, and I'm happy immediately. And I haven't gotten sick of the song, right? It's my happy song. Yeah. Mm-hmm. So make your playlist, your emotional playlist. You want to get, to feel happy. You want to feel relaxed. You want to sleep. Make a playlist, and the type of music does make a difference.
So we're about to wrap up. Where can people find you?
Probably the easiest, go to the websites. We're always redoing websites and all that, but it's Dr. Worden, DrWorden.com. And then I have, all the social media things that I'm just starting to do more of. I've got a YouTube channel. If you just put in Dr. Worden there, you'll find me. I'll be doing a lot more because I'm doing I've been doing webinars and seminars and workshops, and I've been doing it for my community within me, but I'm spreading out now and letting more people know about it. And the retreats, amazing. We're supposed to be in Costa Rica right now. We shut that down. Barry and I were going to do one together, medical and musical prescriptions for health. We were asked to do that. But with with travel, we just said, let's wait a little while. But love in person, love working with people in person. But Zoom's not in this, what we're on right now, your StreamYard. They all work. It's the best we've got right now. We'll make it work, and know that we can send you some good love and energy, even through this technology.
Yeah, absolutely.
And it can be measured. It actually is real, and it can be measured. There's electromagnetic and magnetoelectric energy. This is getting into physics, but it's real. And it's what I want to leave you with, is that we can make big change within ourselves and with each other if we understand that we are not just a physical mental body. We literally are an energetic body.
It's all about the energy.
Yeah.
Love it. Love it. Love it.
Yeah.
Well, Dr. Worden, thank you so much for your time today. I appreciate you. I got a lot out of it today, and I think a few of our listeners probably got a lot out of it as well.
I appreciate it. Anytime. Sounds great. I loved it. Thank you. The work you're doing, I want to honor you for that. It's a tough field, very tough field, and the reputation of you and your community there is top notch. So thank you for the work that you do in helping people back on their journey.
Thank you so much.